hemisphere damage is unilateral spatial neglect. It involves the inability to report, respond, or orient to stimuli, generally in the contralesional space. It is important to address this problem because it affects activities of daily living, like feeding themselves and other self-care tasks, mobility due to decreased attention to one side of extrapersonal space, and reading by omitting words that leads to poor comprehension of written materials. In general, it distorts the perception of the world, contributing confusion in daily life. There are different theories accounting for the neurophysiological basis of neglect. Attention arousal theory. Unilateral spatial neglect is caused by damage to the structures responsible for arousal and transmission of sensory information to the cortex. This leads to decreased attention to the contralateral side of the lesion. Hemispheric specialization. It has been proposed that the right hemisphere is specialized for attention to both left and right hemispace, while the left hemisphere only attends to the left. Damage to the right hemisphere would conversely lead to losing the main control over left side attention. Disengagement theory. A person with unilateral neglect may find it difficult to disengage or detach his attention from right-sided stimuli. The presence of a stimulus on the right side appears sufficient to obliterate attention to a similar stimulus on the left. Interhemispheric interaction and inhibition. This suggests that it is caused by an imbalance in brain activation, with each hemisphere having specific cognitive and perceptual functions. Left will be activated by language, while the right by spatial tasks. These two act mutually to achieve inhibitory balance. Since the right hemisphere works against the left, damage to the right hemisphere would lead to the increased activity of the left and decreased spatial functioning. Constraint-induced language therapy. The client takes part in language activities in which he is constrained to only verbal responses. No compensatory nonverbal communication strategies are allowed, such as drawing, writing, or gestures. Partial visual occlusion.
Let's do the calculation test. I want you to cross out all the lines you see.
Following the disengagement theory, persons with left neglect have a predisposition toward either hypoattention to the left or hyperattention to the right by using eye patches or hemispatial glasses. Create trial frames adjusted to their levels of visual acuity. Hemispatial glasses have darkened lenses that allowed penetration of 8% visible light to be worn regularly as prescribed. Average daily use of 12 hours have shown significant improvements.
I want you to do this again.
Use with paper and pencil tasks to force the person to use head turning and eye movements to scan into the neglected visual field. This approach suggests that the right visual field of a person with left neglect should be occluded to divert remaining attention to the left side of the stimulus. Perceptual deficit rehabilitation. First, verbal cueing. Perceptual deficit rehabilitation may be performed via cueing. Scanning training attempts to encourage patients to direct their gaze to the neglected site and to scan their environment to the left with verbal cueing by the therapist.
I want you to read the sentence. Brown fox over the dog. Is that all you could see? Yes. Try turning your head to the left.
Oh, the quick brown fox jumps over the lazy dog.
Okay.
Second, visual cueing. Visual cueing includes using a red line or other stimulus placed by therapists on the left margin of the page.
I I want you to read the sentence.
Sunlight, raindrops, air.
Is that all you could see?
Yes.
I want you to try turning your head to the left until you see the red margin.
Oh, when the sunlight strikes raindrops in the air.
Third, auditory cueing. Auditory cueing makes use of a horn or bell on the neglected side to improve awareness of that space. Please read the sentence.
To know my father.
Is that all you could see?
Yes.
Try moving your head toward the sound.
Oh, you wish to know all about my grandfather.
Fourth, optokinetic stimulation.
Look at this.
The patient observes moving visual targets from right to left as it encourages visual scanning of the side that is neglected. On awareness rehabilitation. First, changing bed position. Modify the environment by changing the bed position on the left so as to force the client to scan the environment and direct their gaze to the neglected side. Second, changing table setting. Simplify the visual environment by minimizing the items on the table to improve attention to food and utensils alone. Emotional processing rehabilitation or counseling. Counsel the family on careful education of spatial neglect to be able to truly understand the client's present situation, feelings, and attitudes. Once they are made more sensitive to the client's situation, they will be more participative in management.
You have my undivided attention.